Now, the measles outbreak in West Texas has become a national conversation because now we know a child in that area has actually died from the virus.
So Lauren Crawford joins us in studio now this morning. And Lauren, parents all over the state right now are asking themselves this morning, is my child truly protected from this?
Yeah, I know. And it's a big concern. And health officials say that the MMR vaccine is 97% effective in preventing measles if you or your children received both doses. But the concern is valid. The measles has put 18 people in the hospital so far in Texas. And officials say the child who died in West Texas was not vaccinated and is the first in the U.S. to die from measles since 2015.
The way that I say this is it's because this is a big deal, and we have known that we've had measles in our community. We are now seeing a very serious consequence of what happens when we have measles in our community.
Now, as of this morning, the state health department has identified 124 cases in Texas. Only 5 of the cases are vaccinated individuals, and the rest are unvaccinated or their vaccination status is unknown. Now, due to the highly contagious nature of this disease, health officials say additional cases are likely to occur in the outbreak areas and surrounding communities. And for one Texas mom, Caitlin Norris, whose 8-year-old daughter is showing all of the symptoms, despite a negative test, there is a sense of unease.
It's terrifying. I've read a lot of things about how children have seizures because of the high temperatures of their fevers and brain damage, and they die.
We know if you're in a room with someone with active contagious measles, you have about a 90% chance of contracting that illness if you are not immune.
So parents, if you are not sure whether your child has received the vaccine, most children receive their first dose of the MMR vaccine at 12 to 15 months. The second dose is closer to 4 to 6 years old. Now, you can also ask your child's pediatrician for their vaccine records. And if you think your child was exposed, physicians recommend talking to your pediatrician within that 72 hours.
Lauren, I think that the biggest question that comes top of mind for most of us parents is, since the majority of these cases are really school-age children, what do parents need to look out for, really, for these measles symptoms?
Yeah, well, the past few days we've been talking to several doctors, and they say that high fever is often associated with the measles, as well as some respiratory symptoms like red, watery eyes, as well as a cough, and then also followed by a rash, and that's one of the most common symptoms that we've seen doctors talk about. But public health officials say that someone can have measles for 10 to 14 days before significant symptoms start to show. That's what we heard from the county official earlier just a few minutes ago. And the virus can also linger in the air for up to 2 hours after someone has left the area.
Yeah, some of the Google trends this morning, Lauren, emphasizing the need that people have questions that they want answered. And so we're trying to get those answers for you, including specifically about the measles outbreak and what the vaccination actually prevents and helps with. So we're looking at this closer to home. So we took some of these top questions that you've been asking and searching for online to doctors.
Right. And the number one Googled question here is, are measles deadly? We spoke to the chief of infectious disease at Children's Health in Dallas, and Dr. Jeffrey Kahn says that about 1 to 2% of children have consequences from the measles, such as ear and throat infections. Some kids can develop pneumonia. In rare cases, the brain might swell.
I think the fact that we have 1 death already in just 124 cases really points to the fact that these types of serious illnesses and even deaths occur in measles outbreaks. And we got to make this as a priority, not to take this lightly, even though most of the children who get measles will eventually recover. But
Okay, now, as you've heard, the first case of measles has been confirmed in North Texas in an adult in Rockwall County. So CBS News Texas asked the doctor also, how widespread could measles become in North Texas?
we don't know how widespread this is going to be, and hopefully public health interventions, mass vaccinations, and case tracking will help us control this current outbreak. But I would not be surprised if we start seeing cases throughout the state of Texas and beyond.
So the doctor urges parents to get your children the measles vaccination, which typically starts, as Lauren mentioned, around 12 to 15 months of age.